quality leads to quantity. It was not the other way around. We gave quality, and that is why the numbers are increasing, as we have seen in all our slides. What are our differentiators? I proudly say that there are a lot of differentiators that we have here, which is not available in most of the centers around. One is, of course, the state-of-the-art infrastructure, our daycare. Beginning from a small room in the basement, we have come a long way, and now we have one of the best daycare centers in the entire vicinity. The same goes for the other OT theaters and the radiation machines, which are actually one of the best in the vicinity. And our another biggest differentiator is the biggest team of oncologists in the Delhi and NCR. It is not only the number, we are big in number, but also in experience also. Some of the most experienced oncologists in the city are with us. The team needs no introduction. You already know most of them. And again, our important differentiator is the multidisciplinary and multi-speciality tumor board. Each and every case, as was exemplified in the 4 cases that we discussed today, has to go through a tumor board which will consist of not only a surgical, medical and a radiation oncologist, but will also take into account the opinion from a radiologist, pathologist, nuclear medicine specialist and a molecular oncologist. Our other differentiators are the expertise to carry out complex surgeries with least complications, the only center with the expertise in scarless procedures like vacuum-assisted biopsies and lumpectomies. It is a prestigious institution, as we saw in the case discussed by Dr. Geeta. Sentinel lymph node mapping is a routine here, which saves so much morbidity for the patient, and not many centers in Delhi and other North India seem to be doing this procedure. The same goes for other things like HIPEC. HIPEC, one of the few centers in not only Delhi, one of the few centers in all over India. HIPEC, we have begun with HIPEC and we have got 100% success rate so far. Reconstruction surgeries with excellent results. High precision surgeries, as exemplified in the case discussed by Dr. Mudit, with voids conservative surgeries. And also now we have also acquired the scarless endoscopic transoral laser surgery with the latest high-end machine which is almost compatible with the robotic arm, with excellent promising results. The only center, as highlighted by Dr. Vinita, with expertise for electron beam therapy and the other radiation techniques, which she has already highlighted. Our other differentiator is a world-class BMT unit. Dr. Rahul exemplified about it, successfully carrying out year on year so many autologous and allogenic transplants. And then gone are the days of age-old chemotherapeutic molecules. We have better molecules, better chemotherapeutic techniques, better delivery devices, and targeted therapies have come up in a big, big way, which are being routinely done at our center. And one of the few centers across entire India with facility for ultrasound-guided PICC line insertions and dedicated team which is managing all these. We have also the expertise, the team, the nurses, the expertise for giving all sorts of regional chemotherapies. HIPEC we all heard, and apart from that, various other regional, all kind of other regional intravesicular chemotherapies are being routinely given at our center. And we are also a differentiator in the way that we are the proud owners of first familial cancer clinic in whole of North India, giving genetic counseling to all the high-risk families and personalized cancer medication and precision medicine. This is just part of the story. Quality, we give the best, but in the meantime, we also don't forget that our patient is not merely a bundle of disease. Our patient is a human being that has been diagnosed diagnosed with something like cancer, and the family what it is going through. Apart from giving the quality services, the best opinion, the multimodality treatment, we know how to hold hands of our patients. That has been exemplified with the mention of the support groups that has been exemplified by Dr. Geeta, Dr. Mudit. We have breast support group, laryngectomy support group. Basically, we have support groups for all our cancer patients, and these are also, needless to say, our support groups are also our USPs, not being offered by many cancer centers all over India. Plus, we have a psychologist on board who does counseling of all our patients and their families. Well, the journey has just begun. These are just the pictures of the few of our support group meetings which are being routinely done. And the journey has just begun, and apart from with this continuous monitoring, we have come a long way with progress, with appreciation from all of you, from all the vicinity, from our competitors also putting faith in us, and which has given confidence to the entire team and has led to our success. And at the end, I would like to just say, to give real service, you must always add something which cannot be bought or measured with money, and that is sincerity and integrity. And that we intend doing at Max Cancer Center. And we have miles to go before we sleep. And we, the team Oncology at Max, thank you all for all your support for making this cancer center a big center.